It's challenging for people when they see barriers, like barriers to accessing mental health services. But we can turn those barriers into bridges and create the services and the access that we all want and need. I am Dr. Jameca Woody Cooper. I am a board certified counseling psychologist. Overall, I've been in private practice in St. Louis for almost 20 years.
There's a dearth of psychologists that are able to do the work that she can do, especially when it comes to those in the marginalized communities. When I looked at the past recipients, I was just really struck by the number of very impressive women of color that have received this award. And I started doing some research on them, and I realized my wife can be a part of this. My name is Sean Cooper. I am the Director of Field Services and Organizing with Illinois Education Association.
My practice, Emergent Psychological Services, started off as being devoted to older adult mental health, but over the years, it's kind of morphed into adults and children and adolescents and couples and families. I also teach aging and abnormal psych at Logan University. I also work as a criminal psychology consultant, working with attorneys in the area and outside of the state as well on cases that involve mental health and trauma. Well, mental health really impacts children and families in the St. Louis region a great deal. The rates of anxiety have increased, the rates of depression have increased, and the rates of trauma have increased for young people. In addition to that, when we think about a really urban area like St. Louis, you also see young people who are exposed to large amounts of community violence. So when you think of the levels of trauma and the basis of the trauma, it's quite vast when we think about this area.
One of the things that surprised me was her willingness to visit others in their homes. She told me, well, sometimes you have to take the service to them. Not only is she meeting with the patient, but also the family. So I think that reduces the stigma because people are able to see how a trained psychologist can work and also frame things where it actually applies to them and their culture and their background.
Primary care, I would say in St. Louis, has done a really wonderful job over the past 15 years of trying to be more integrated with their care. So a lot of the primary care physicians in the area have been better about working with mental health practitioners and making sure that their patients, our clients, get the care that they need. I think one of the biggest things I'm most excited about is really trying to be more involved in the training of a new generation of mental health providers to make sure that they have the skills and the competencies needed to really go out and serve their communities.
She is a visionary. She's not a sit-and-getter. She goes out into the community and she has a knack for bringing others in and reaching them where they are. I think those types of skills and that drive, I think it mirrors those of the impressive women that have already received this award in the past. So I think she's among that group.
I am honored to receive the Community Mental Health Provider Award this year. It means a lot just to be recognized by my community, the same community I've worked in for all of my career, which tells me that mental health services in the community are appreciated. And I think sometimes us as practitioners, we don't always feel that. So I think this is great, not just for me, but my colleagues and my peers as well.